This week on Healthy Living, we look at arthritis, one of the leading causes of pain and disability worldwide. Epidemiologist Dr. Dawud discusses the causes and management of arthritis and how to improve joint health. And did you know that decluttering could improve your health? Plus, we'll have the story of two Mozambicans who are redefining life with disability. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Lina Khmudu. Thank you for joining us for another edition of Healthy Living. Arthritis is a group of diseases that cause swelling, pain, and stiffness in and around the joints, making it hard to move and to do everyday tasks. It is one of the main causes of pain and disability worldwide. There are over 100 different types of arthritis. The most common one is osteoarthritis, which affected about 528 million people globally in 2019, according to the World Health Organization. Osteoarthritis is also the most common form of arthritis in Africa. Vicky Stark reports on how patients and experts in South Africa are addressing the condition.
Helen Gabriel was diagnosed with arthritis in both her shoulders almost 4 years ago. She says medications alleviate the pain for only 10 minutes.
Nothing seemed to help. But in a day, it's not so bad. I can still clean my place, whatever, but slowly. I take my time doing it. But I can still manage to do that. Thank you, Lord, for that. I can do that. But at the night, then is the time I want to sleep and I suffer. Then I suffer.
Redefining Hospital, one of the biggest medical facilities in Cape Town, has a rheumatology clinic. Dr. Ayanda Qelu, who works there, explains that there are several types of arthritis. She says early detection of the disease is crucial and can help prevent joint replacements.
Early morning stiffness. So if you feel stiff, you wake up, you feel so stiff, not just for 2-3 minutes, but stiff for 30 minutes or longer. So your stiffness takes time to resolve. Then that is a sign that there is a problem. And swelling in the joints.
Dr. Qelu says the most common form of arthritis is from wear and tear, affecting people over 50. It is called osteoarthritis. She says having a good diet is always a great idea. Another is movement.
Especially for hip as well as knee arthritis, that you need to exercise your muscles, because the muscles, once they are stronger, they help to align the joint.
She says occupational therapy can also help.
Especially when they develop the arthritis at the base of the thumb, it's much more common there. You can refer them to OT, and then they can make some special gadgets for them that will help support the joints.
Helen Gabriel's arthritis is acute. But Dr. Qelu says many people with arthritis are able to manage the disease with pain relievers, anti-inflammatory remedies like steroids, and anti-rheumatic drugs. Managing the disease, she says, has allowed some patients to move effortlessly, even climb Mount Kilimanjaro. Vicky Stark, VOA News, Cape Town, South Africa.
What do you think could cause arthritis and joint problems, and what tips could you share to relieve joint pain? Here are some reactions from Cameroon.
First, I know that arthritis is an inflammation of the joints of the fingers, which is caused by the wear and tear over time, as well as by a weakened immune system.
Arthritis is a bone-related disease that attacks the joints.
Arthritis, in my opinion, is a disease that is linked, as you say, to the joints. So as I said earlier, it's caused by lack of exercise.
This is phenomenon because at a certain age, the body no longer secretes calcium.
I'd say it's simply the weight of age. The older we get, the more our strength fails us.
It's mainly problems of diet. That's the cause. When it comes to diet, 95% of people don't eat healthy anymore.
Diet is the first cause of all these ailments. Secondly, women don't take care of themselves. In fact, human beings don't take care of themselves properly. They don't exercise enough either. So these are the two causes, diet and exercise.
We have a few tricks up our sleeve. For example, calcium magnesium, which is highly recommended. Keep moving and take food supplements in general. The good ones are especially indicated for this kind of case.
You need to take calcium from time to time. That is what is going to keep you going for a long time. That is just my opinion. And you need to know what to eat. Eat a lot of fruits and drink enough water. Avoid beer because it contains substances that are not released by the body.
I'd say eat well, drink plenty of water, and exercise regularly.
Well, my tips for relieving joint pain are anti-inflammatories, balms, and you also have to practice sport. By doing physical exercise, you can also relieve joint pain.
Dr. Adam Dawud is a consultant epidemiologist with WHO. He sheds light on arthritis and how to manage the condition.
Arthritis, as the name implies, is the inflammation of the joints. The joints in our body tend to have some inflammatory response. And when that happens, it is characterized by some pains, stiffness, immobility, and sometimes deformity. And the risk factors that cause arthritis are numerous. However, age is one of the risk factors. So people that have attained 40 years and more tend to face more problems of their joints or with their joints, so that inflammation of the joints is seen. Another important factor that nobody has control is genetic. Some people can inherit arthritis based on their genetic makeup. So if their parents have it, it can be transferred to them. It has a lot of consequences in daily life because it presents with pains. So you see, if you are faced with pains, you will find it difficult to actually continue to do one or two things that you can freely do before without the pains. And the arthritis itself can lead to what? Immobility. You will not be able to move or utilize the joint that is affected. Due to our poor health care system, arthritis is a great public health concern because most of the people present only when they have pains. They will be managing it until when pain is evident that they will now come to say they are seeking for one or two assistance. By so doing, you realize that it might be late. If you have been diagnosed with arthritis and you want to live a normal life, as I have said earlier, you have to comply with your drug treatment. You have to continue to avoid the sedentary lifestyle. So you must try as much as possible between 2 to 3 days in a week. You go out for 1 or 2 exercises that will actually mobilize yourself. And sometimes when the deformity is already trying to ensue, we advise the patient we link the patient up with physiotherapists so that they will actually try to make effective movement of the joint. And by so doing, they tend to do better.
Are there some items in your house that are accumulating and not organized? If the answer is yes, it may be time to declutter. Experts say clutter triggers a physiological response, raising cortisol, the stress hormone. Disorganization overwhelms the brain, increasing stress, anxiety, and making it harder to focus. Clutter can also trap dust and allergens, leading to respiratory diseases like asthma. Decluttering can reduce stress, improve air quality, enhance sleep, and greater mental clarity. Here are some practical tips to begin. Start small with one area or category like clothes or the bathroom. Try the 10-minute rule. Spend 10 minutes daily decluttering. One in, one out. Remove an item for every new one. Sort through items. Keep, donate, recycle, or trash. Small efforts can create a calmer, healthier home. Now, living with a disability presents unique challenges, but some people living with a disability relate how their resilience, determination, and support from family and friends can help them thrive. From Maputo, Mozambique, reporter Amaryllis Gule has this story of two Mozambicans who refuse to let disabilities define their lives.
Delfina Nyantumbu is studying education and social action at Mozambique's Pedagogical University of Maputo. She has a condition called cerebral palsy that affects her ability to move and balance. Despite this, Delfina started an association called Flicker of Inclusion Association to help people like her.
I have an association that helps people like me. I help them to realize that they can go to school, that they can work and have a normal life.
Julia Francisco, Delfina's mother, has supported her along the way.
She is helping a lot of families. When she knows that somewhere there is a child with special educational needs or a disability, she goes to visit. I got feedback from parents saying that Delfina came to take us out of the deep end. We didn't know what to do with our son, but with Delfina's visit, we were able to see that our son is also capable.
I was always afraid, but after I joined the association, they helped me to understand what I was worth. It helped me to want to go back to school because I had already given up. But she made me understand that I am capable and that I can go far.
Nyantumbu says feedback like this keeps her going.
My focus is to continue fighting for the inclusion of people with disabilities. Girls with disabilities have faced more difficulties, first because they are women and then because they have disability, but they can do thousands of things.
Rafael Bata is visually impaired but found refuge in music as his sight faded. Inspired and mentored by blind Mozambican musician Isaú Menezes, Bata learned how to play the guitar and formed a band made up of visually impaired people. He earns a degree in journalism and works as an advocacy coordinator and presenter on Death TV, a Mozambican non-governmental, non-profit organization that promotes inclusive social participation.
It is still a big challenge to be a person with a disability because society still doesn't respect the rights of people with disabilities.
Bata created a theater group for people with disabilities as a way to continue fighting for the disabled. Nyantumbu says she will continue to work towards a future without limitation for people with disabilities. Amaryllis Gule, VOA News, Maputo, Mozambique.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linochmudu. Until next time, stay well and strive to make every day a healthy day.
Madame, Monsieur, bienvenue.